Hello guys, welcome to Easy Anatomy. In this video, we are going to see about the hard palate. Okay, now let's see about these general features. The hard palate is nothing but the partition between the nasal and the oral cavities. The nasal and the oral cavities is separated by hard palate. The hard palate is formed anterior 2/3 by the palatine process of maxilla and posterior 1/3 by the horizontal plate of the palatine bone. Anterolateral margin of the palate continues with the alveolar arches and the gums. It's anterior. Anterior is continuous with the alveolar arches and the gums. Posterior margin gives attachment to the soft palate. The superior surface forms the floor of the nose. And the inferior surface forms the roof of the oral cavity. Now let's see about the arteries. It is supplied by greater palatine artery, which is a branch of maxillary artery. Veins, it is drained by pterygoid plexus of veins. Nerve supply, greater palatine nerve and nasopalatine nerve, which is a branch of pterygopalatine ganglion suspended by the maxillary nerve. And lymphatics, upper deep cervical and retropharyngeal nodes. These are about the hard palate. Now let's see a mnemonic to remember the arteries, veins and nerves and the lymphatics. The mnemonic is GP, that is greater palatine artery. Pace per view, that is PPV. Pace per view, that is pterygoid plexus of veins. 2. GP's national park, that is there is two nerves supplying the palate, hard palate, that is the greater palatine nerve and the nasopalatine nerve. 2. UR, that is unreserved, that is U for upper deep cervical and R for retropharyngeal. That is GP pace per view to GP's national park, 2 unreserved. It has no meaning at all, but still then you can remember this as a mnemonic for the hard palate. So let me write here with another color, that is GP pace per view to GP's national park, to unreserved. Here let me explain you once again. GP is the greater palatine artery. Pace per view means pharyngeal plexus of veins, and 2, that is 2 in number. The nerves are 2 in number, that is greater palatine nerve and nasopalatine nerve. And the lymphatics are 2 in number, that is the upper deep cervical and the retropharyngeal. Let me revise you once again. Before that, let us see in this diagram. This is the picture of the hard palate. Anterior 2/3 is formed by the palatine process of maxilla, and the posterior 1/3, which is formed by horizontal plate of palatine bone. Here you can see intermaxillary suture. See this? This is the intermaxillary suture. This is the palatomaxillary suture, and this is the cruciform suture. These both forms the cruciform sutures. Okay, and well, this is the posterior nasal spine. This is the palatine crust. You can see a crust here. This is the pyramidal process of palatine bone. You can see a pyramidal process here. And this is the interpalatine suture. You can see 3 sutures here, that is the intermaxillary suture, interpalatine suture and the palatomaxillary suture. And you can see 3 foraminae, that is the incisive foramen, the lesser palatine foramen and the greater palatine foramen. Let me revise you once again. Hard palate is the partition between the nasal and the oral cavities. The anterior 2/3 is formed by the palatine process of maxillae. The posterior 1/3 is formed by the horizontal plates of the palatine bone. The anterolateral margin continues with the alveolar arch and the gums. Posterior margin gives attachment to the soft palate. Superior surface forms the floor of the nose. Inferior surface forms the oral cavity. Arteries: greater palatine artery, which is a branch of maxillary artery. Veins: pterygoid plexus of veins. Nerves: greater palatine nerve, nasopalatine nerve, which is a branch of pterygopalatine ganglion, suspended by the maxillary nerve. Lymphatics: upper deep cervical and retropharyngeal. Mnemonics: GPay pays per view to GPs. National Park to UR, that is unreserved. Thank you. If you like this video, please do like, subscribe, and click the bell icon for the further updates. You can get these notes from my Telegram channel. The link of the channel is given in the description.